So to get a sense of what that care looks like and what we can try to understand from decoding his doctor's news conferences, let's turn again to Dr. Ali Khan, former Assistant U.S. Surgeon General. He joins us from Omaha, Nebraska. And Doctor, thanks for joining us again.
Thank you. Good evening, Ian, and thanks for the opportunity.
So slowly we got a little bit more information on Saturday and especially today from the doctors. Based on that, what is your sense of the state of the president's health?
Thanks, Ian. That's a good question. I think your earlier phrase about decoding was well framed because it's not really clear that we have all the information on when the president became ill, first had his symptoms, first was tested. But from what we have been presented, it appears that he has moderate disease. He had a decrease in his oxygenation level. He required hospitalization, which is what's happening right now, and has been treated with the 3 optimal drugs that he could be given, including dexamethasone, which is for people who have required oxygen.
Yeah, so let me ask you about that, because I've heard some analysis today where people are saying, again, trying to do this decoding, that kind of by definition to administer that to him suggests a fairly, I don't know if severe is the word, but what does it tell you about the level of COVID infection that he may have?
So I would probably use the word moderate, at least moderate. I mean, from what we can tell, he's not currently on oxygen, he's not ventilated, he's not in an ICU, but he must have had moderate disease for them to make a decision to start him on dexamethasone.
And he's also been given, we're told, an experimental therapy. I've heard some doctors from the United States saying that is not something that would be available to them. And again, do you think that's a sign of kind of pulling out all the stops when it comes to the president, and or you have a fairly, at least moderate case, and so you need to use everything you could possibly use?
So the use of dexamethasone is approved in the United States and worldwide right now, so that makes complete sense. The same thing for remdesivir, which is an antiviral drug we give early in the illness. That's also approved in the U.S. It doesn't save lives, but it may prolong, it may decrease the illness, and you may get to go home a couple of days sooner. The first drug he got, you are quite correct, that's not currently approved in the United States. It's still experimental, but it's the equivalent of essentially using what would be a plasma, convalescent plasma. So people who've been sick trying to get their really good antibodies, and this product that he got would be a version of that. So, and we believe that this would be a good option in the future for individuals.
We've all seen, I'm sure you have too, the video of him being driven past the hospital. And I want to ask you a question, not as a political comment, but medically, in terms of the potential of spreading the virus. Watching those pictures, does that concern you?
Any person who is infected, acutely infected with COVID, should be in isolation, and strict isolation for 10 days. And that means not exposing anybody else. And that applies to anybody worldwide, because you don't want them to infect anybody else.
There are the sort of, let me call them kind of strict health issues. What is his lung function? Does he need oxygen? There are all those things. But there's another thing I hear people talk about, at least some people who have moderate to serious COVID symptoms, and that is the impact, they say, on their cognitive function. That I've heard people talk about kind of a COVID fog that they feel sometimes lingering for long after the acute time that they're sick. How concerned should we be when somebody that faces the demands of the president is dealing with COVID and what lingering effects there might be mentally?
So this is a concern actually for everybody, and why I'd like to remind people that death is not the only outcome in this disease, because we do know that there are complications of illness. Most people, so try not to be fear-mongering, most people get better in 2 to 6 weeks, even though at about 3 or 4 weeks, about a third would say that they're not completely better. However, we do know that individuals can have persistent symptoms for months, usually sort of fatigue, shortness of breath, and some of them may be so severe that they may have what we call a post-infectious fatigue syndrome. And these people are called long haulers or long COVID. So that's one concern. And then if you look using sophisticated testing, people can have lung damage, they can have heart damage, You talked about the brain fog. They can have confusion and headaches. It's not clear what the long-term implications of these abnormalities in their heart, lung, or brain or kidney may look like. So yes, still unanswered questions in this disease.
Well, what is clear is your analysis, and thank you once again tonight for helping us through that.
Thank you very much for the opportunity. Have a lovely evening.
Dr. Ali Khan in Omaha tonight.